Talking to Dr. Stephanie Bailey, the director of the Metropolitan Health Department. And of course, Dr. Bailey, before we had our first commercial break, we were talking about some of the issues dealing with the Metropolitan Health Department. But let's look at some of the health issues that you have to deal with. And in order to sort of tie it in with that first segment, to talk about these issues as they relate to Nashville, and if there are some similarities or some differences between issues here and elsewhere, give us that kind of information, to simply give us the information that you'd like to give us concerning health issues.
What we're finding is that as Nashville grows bigger, the problems become more like big city problems, even though we have a small town feel. Things like tuberculosis, multi-drug resistant tuberculosis. There are increasingly more counties in the nation that are not reporting any tuberculosis at all. We're finding that the counties that are reporting this resistant type of tuberculosis are mostly your urban communities. And Nashville has had its share in the last 2 or 3 years of the really recalcitrant tuberculosis patients and difficult bacteria to treat. The same thing with issues around HIV and AIDS. I'm going to throw crime in there and violence. A lot of people do not think of that as a public health problem, but it is. Anytime you have persons dying at an extraordinarily rate, and what they're dying from is potentially preventable, it becomes a public health problem, because our primary premise is prevention. Whether it's you're shooting a gun or not, whether it's you're choosing to have safe sex or not, choosing to wear a seatbelt when you drive a car, choosing to drink and drive, choosing to eat your fibers and your fruit, choosing to eat high fat, choosing to not exercise and sit around all day. These are lifestyle choices, and these are the things that are critically important when you talk about causes of death, because there are some things that are potentially within your control. So violence is a public health issue. You have extraordinary number of youth being killed in Davidson County. We were the 7th ranking city in 1996. Now, that's an issue that should involve all community. So those are things that you find pretty much in urban community. Drugs, substance abuse, high, gangs, criminal activity, sex for drugs. We find those things are here as well in Davidson County. The issues, when you're thinking about how we deal with them, you'll see as I've outlined them that they aren't just purely physical health issues. They aren't purely mental health issues. They aren't purely social service or law enforcement or, you know, any one entity. These are issues that all of us have to come together, get out of our turfs, and create the system where these issues can be addressed, because no one can do these alone. And one of the roles that public health does play is in bringing all the entities together to see how do we together more effectively, you know, transcend on these issues. The other thing about the issues is that they are issues. What about the system that's in place that getting our kids graduated and successful in society? We have dropout rate. We have a lot of things that I can say are negative, but what are the things that are the assets that are in place, and what assets are not in place in this community as a whole to show that we are a community that cares, that gets this infant from here to successfully graduated. That's a quality of life issue. That's a health issue. It's a public health issue. So the things I'm talking about are really embedded in a lot of community type of things. Poverty, lack of infrastructure in neighborhoods to actually deal with themselves, the problems that you have, whether it's an abandoned car that looks like the neighborhood's not being watched, so there you have gang activity and drug activity, and not knowing how to get a handle on that. It's about empowering neighborhoods. And since we can get information down at that level, it brings to them at least some picture of what the problem is. And then it moves them towards being able to solve it, perhaps.
I think I guess one of the greatest efforts then dealing with the department would be that of education. That is simply trying to get the word out in reference to what is going on. You know, quite recently, I think it was reported in one of the newspapers that there's an epidemic in Nashville in syphilis. And what I'd like for you to do not only is to talk about that, but give us some definitions in terms of is there actually an epidemic in Nashville and dealing with syphilis in this community, and talk about it from that perspective. How very, very serious is this?
As Director of Health, yes, I have declared an epidemic around syphilis. And when you declare an epidemic, what it means is that there are excessive numbers other than what would be expected. And in addition to those numbers being unexpected, when you expect the trend to go, say, like this, our numbers are beginning to go like this and have been since 1995-96, when the rest of the nation is coming down. We were number 5 in the nation about 2 years ago, and the ones that were ahead of us are beginning to come down, like Baltimore and Memphis. And we're now number 2 behind Memphis in syphilis. So yes, it is an epidemic. The numbers are small, but still, it's enough for us to be concerned, and it's enough that we can get our hands on it, because there does not have to be any syphilis in this community. And it is more about education and getting the word out and having people understand what syphilis is and what the consequences of syphilis is if it goes untreated. The behaviors that go into syphilis are also the behaviors of other STDs like gonorrhea, chlamydia, herpes, HIV. They're also the behaviors of tuberculosis. They're also the behaviors of substance abuse and those type of things. So it's like a sentinel effect, or the iceberg that would get at a whole lot of other things. And it takes information to get out about those issues for us to do something about it.
Very good. And of course, we're coming up to our second commercial break here, Dr. Bailey, and I think that when we come back, we'll have about 6 minutes to give you an opportunity to talk about what the Metropolitan Health Department is doing in terms of trying to meet this epidemic. And we'll be back with you following this short commercial.
Here's